One of the more than 2,000 deaths in Illinois, just 3 were under the age of 19. One of those was 18-year-old Caitlin Whisnant. She had just celebrated her 18th birthday. We're going to start with that story tonight. CBS 2's Jim Williams spoke to her family and explains why one group of children is particularly vulnerable.
Caitlin Whisnant was the youngest of 5 children who loved to make other people happy, her parents Jody and Kristen told us.
She was a kind, quiet, loving, wonderful child.
Caitlin, she was my right hand here. If something needed to be done, she was always here helping me.
Even as a teenager, she would hold my hand, she would hold my wife's hand when we'd go out in public. And you know how rare that is.
Caitlin, who excelled in math and science, was born with a genetic immune deficiency. Early this month, she was diagnosed with COVID-19.
I talked to her via video call. Honey, how are you feeling? Dad, I feel fine. I'm just a little tired.
But minutes after that conversation, less than 2 weeks after her 18th birthday, Caitlin Whisnant died.
I found her passed away and tried to revive her.
The COVID-19 fatality rate among the young is low. Only 3 under the age of 20 have died of the disease in Illinois.
Children, compared to adults, are a relatively less affected population when it comes to COVID-19.
Dr. Larry Kosciolik is Director of Infection Prevention and Control at Lurie Children's Hospital.
About 80% of the children that we've diagnosed with COVID-19 have not required hospitalization. And many of those children have had such a mild illness that they probably did not need to be seen by the pediatrician either.
I would want the world to know how wonderful our daughter was.
Caitlin's parents are asking people to think of those who are the most vulnerable during this pandemic.
You and I may feel fine, but this is about everyone, everyone else. It's about the bigger picture.
Caitlin's funeral was Saturday. Only family members could attend. Her mother has COVID-19. She is recovering. No other family members are showing symptoms, Brad.
Jim, heartbreaking. Do doctors know why COVID-19 mortality is so low with children 18 and under?
They don't fully understand why, Brad. It is a new virus, but children with pre-existing conditions are vulnerable, like adults are vulnerable with pre-existing conditions, and we know that Caitlin was born with a compromised immune system.
Okay, Jim Williams, thank you tonight.